Welcome back to Medic Talk, everybody. You ready to conquer some more of those tricky medical concepts?
Always ready. Let's do it.
All right. So you know that feeling, right? Like when your throat gets all scratchy, your nose is running like a faucet?
And you suddenly can't live without a box of tissues?
Exactly. The common cold. Today, we're going to do a deep dive into everything you need to know about it.
Sounds good to me.
From those sneaky viruses behind it to managing those annoying symptoms. Let's get started.
Yeah, it's amazing how something so common, like you said, the common cold,
Right.
people still don't really understand it. A lot of people think it's always coronaviruses. But did you know there's actually over 200 different viruses that can cause a cold?
Over 200. Whoa, that is a lot. No wonder we get them so often. So let's break this down a little more. Which viruses are the most common culprits, would you say?
Well, the king of the cold, I would have to say, is the rhinovirus. It's responsible for about half of all cases.
Wow.
And to kind of put that into perspective, imagine a doorknob, any doorknob. Scientists estimate that there are more rhinoviruses on that single doorknob than grains of sand on an entire beach.
That's amazing. And also kind of terrifying. So this tiny little virus is like waging war on our bodies. But how does it actually all play out? What are the stages of a cold?
Well, think of it like a play, a three-act play.
Okay.
Act 1 is the early stage, and that starts within a day or two of being exposed to the virus. And for most people, the first sign is a sore throat.
Right, that telltale scratchiness.
Exactly. Then comes the runny nose, sneezing fits, maybe a cough, hoarseness. Your body's basically like sounding the alarm, trying to flush out those invaders.
Yeah, it's that point when you're like, oh, here we go again.
Right.
Then it gets worse. So what happens in Act 2?
Act 2 is when things really ramp up.
Yeah.
It's the octave phase, so that's days 4 to 7.
Okay.
And those initial symptoms you were just talking about, they intensify. And you might start feeling achy and tired. You might get headaches. Kids especially might start developing a fever. It's kind of the peak of the battle between your immune system and the virus.
So you're loading up on pain relievers?
Yeah.
Cough drops, you're basically camped out on the couch.
Pretty much, yeah. And then comes Act 3. That's the late stage around days 8 to 10. And that's when you're finally over the hump, the worst is behind you. But that nagging cough can linger for weeks.
Oh, the lingering cough. I hate that.
It's like the aftershock.
Right, right. A reminder that even though you won the battle, you still need time to recover. This has been great information. But what about babies? How do their bodies handle things?
Babies, they have their own kind of cold drama. Obviously, they can't tell us what's wrong, so parents and caregivers need to be extra vigilant. So look for things like increased drooling, which usually means a sore throat.
Makes sense.
They might be fussier than usual, and you might even see their glands are a little bit swollen.
So you really have to be like a detective, looking for any little sign.
Yeah.
But are there any, serious red flags with babies where you would need to call the doctor right away?
Of course, if a baby under 2 months old gets a fever, go straight to the doctor. Don't wait.
Got it.
Also, be on the lookout for any kind of breathing difficulties. So things like nostril flaring if their breathing is rapid, if you hear wheezing, or if you can see their ribs with each breath, that can be serious. Dehydration if they're excessively cranky or sleepy. If a cough lasts more than 3 weeks, those are all reasons to call your doctor.
Okay, so parents, listen up. Trust your gut. Don't hesitate. Call your doctor if something feels off. Now, I want to get back to those sneaky viruses.
Okay.
We talked about how rhinoviruses are a major culprit. But how do they actually spread so easily?
They are masters of transmission. It basically all comes down to direct contact. So think about a sneeze, a cough, like a viral explosion. All these tiny, invisible droplets, they're filled with the virus. They become airborne, ready to invade a new host.
Like little ninjas.
Basically.
So if you breathe them in, you're in trouble. But it's not just breathing them in, right?
Right. You can also get infected by touching something that's contaminated. So a doorknob, toys, even your phone. And then you touch your face, especially your eyes, nose, or mouth. Those viruses can live on surfaces for hours.
Oh, great. So we're surrounded by these little germ landmines.
Pretty much, yeah.
But what about the contagious period? When are we most likely to spread the cold?
This is where it gets really tricky. You're actually contagious for up to 2 weeks.
Wow.
Even before you start showing symptoms.
So even if you don't feel sick, you could still be spreading it around.
Exactly. But you're most contagious during the first 3 days of feeling sick. That's when those viral armies are at their strongest.
So even if you have a little sniffle, you could still be spreading those ninjas.
That makes sense why colds are so common, especially with kids. Why do kids seem to get hit so much harder than adults?
Well, think of their immune systems as still being in training.
Mm.
They haven't encountered as many viruses as adults, so they haven't really built up that strong defense system yet.
Mm.
And let's face it, kids aren't exactly known for having good hygiene.
Yeah, that's true. Sharing toys, touching everything, putting things in their mouths. It's like they're rolling around in a germ playground.
Right. And remember, those viruses, they can linger for a while. So parents, it's a constant battle to keep those little hands clean and germ-free.
I bet it's exhausting.
It is.
So we know colds are super common. They spread like wildfire. And kids are basically like walking petri dishes.
Yep.
But how do doctors actually diagnose a cold? Well, usually it's pretty straightforward. It's based on your symptoms and a physical exam. So the doctor will look for things like nasal inflammation, a red throat, swollen lymph nodes. They might take a nasal swab to rule out other infections like the flu or COVID.
Speaking of other infections,
Mm-hmm.
antibiotics, right?
Mm-hmm.
I know it's a common question. Do they actually work for colds?
This is where a lot of people get confused. Antibiotics are great for bacteria, but they don't work on viruses. So taking an antibiotic for a cold, it's not going to help.
Okay, so if antibiotics are out, then what options do we have for actually fighting those invaders?
Well, we can't kill the virus directly,
All right.
but we can help our bodies fight back,
Mm-hmm.
and we can manage the symptoms, and that's where over-the-counter medications come in.
Right, the infamous cold and flu aisle at the pharmacy.
Mhm.
It can be so overwhelming.
Absolutely.
So many options. Can you help us navigate that? What are the key types of OTC meds, and what do they actually do?
Think of it as your symptom-fighting toolkit. You got pain relievers like acetaminophen or ibuprofen.
Mm-hmm.
Those can help bring down a fever, and they can deal with those aches and pains. Then there's decongestants. Those help unclog a stuffy nose by shrinking swollen blood vessels.
Mm.
You got antihistamines. They dry up a runny nose and reduce sneezing by blocking that histamine response. And then you've got your cough suppressants to quiet that cough. And then expectorants to loosen mucus and make it easier to cough up.
Wow, so there's basically a medication for every symptom.
Yeah.
But what about the dosage, especially for kids? Can you just grab whatever's on the shelf?
That's a really important question. And the answer is no. You should always consult with your doctor or your pharmacist before giving any medication to a child, especially cough and cold medicines. Children's bodies process medication differently than adults, and the dosages need to be carefully calculated based on their age and weight.
Good point. It's always better to be safe than sorry, especially when it comes to the little ones. Now, what about babies? They can't exactly pop a cough drop, right? What are some ways to safely and effectively treat colds in infants?
You know, for babies, it's all about comfort care, just helping them through those symptoms. Offering plenty of fluids is really important.
Right, so breast milk or formula for the little one.
Exactly. And water for those babies over 6 months old, saline drops, those are great for stuffy noses, and a bulb syringe can work wonders for clearing things out.
Yeah, those are lifesavers.
Mm.
So it's really more about soothing and supporting their little bodies rather than trying to cure the cold, right?
Yeah, exactly.
Are there any other things parents can do to make their baby more comfortable?
For sure. Keeping the air moist with a cool mist humidifier can really help ease congestion. Putting a little petroleum jelly around their nostrils can prevent irritation from wiping their nose all the time. And sometimes just holding them, rocking them, and letting them know you're there can be the best medicine.
That's nice. Okay, we've talked a lot about treating colds, but what about preventing them in the first place? Is there any way to avoid these little ninjas altogether?
You know, there's no foolproof method, but we can definitely reduce our risk. So think of it as building up your defenses, your fortress of defense.
Okay, I like it.
First line of defense, impeccable hand hygiene. Wash your hands frequently with soap and water, especially before you eat, after using the bathroom. And if you've been around someone who's sick, and I mean really wash them, scrub for at least 20 seconds. Get under your nails, between your fingers.
The 20-second rule, I remember learning that in school. We used to sing happy birthday twice
There you go.
to make sure we were doing it long enough.
Yeah.
What about if you're on the go, though, and you don't have soap and water?
Hand sanitizer is a good backup plan. Just make sure it's at least 60% alcohol.
All right, hand sanitizer, got it. So hand hygiene is crucial, but what about those internal defenses?
Right.
What can we do to boost our immune system so that we can fight off those colds?
Think of your immune system like an army, you know? You want to keep it strong and well-equipped. So that means getting enough sleep,
Okay.
eating a healthy diet, and exercising regularly.
It's like training for a marathon. You can't just start the day of.
Exactly.
You've got to build up that immune system.
And here's another weapon in your prevention arsenal. Avoid close contact with people who are sick. I know it's not always possible, but if you can steer clear of those coughers and sneezers, you'll greatly reduce your risk of catching that cold.
It's like social distancing, but for the common cold.
Right.
So we've got hand hygiene down, immune systems are pumped, we're avoiding those sick folks like the plague. What else can we do?
Don't underestimate the power of just cleaning. Disinfecting frequently touched surfaces. Think about everything you touch throughout the day. Doorknobs, light switches, countertops, your phone.
Oh yeah, my phone. That's probably pretty gross.
Give those surfaces a good wipe down with disinfectant and do it regularly.
So just make it less hospitable for those viral ninjas?
You got it.
So many good prevention tips. I know a lot of people swear by certain supplements and home remedies to prevent colds. Is there any truth to that?
Well, let's talk about that hot topic. Let's jump into the world of supplements and home remedies. See what's actually out there for cold prevention.
All right, so many products claiming to be the ultimate immune booster and cold fighter. Do any of them actually live up to all that hype?
Well, the research is a little mixed, to be honest with you. Some supplements show some promise, others not so much. So let's start with zinc.
Okay.
A mineral that a lot of people talk about for its immune-boosting properties. Some studies have actually shown that taking zinc supplements, but you have to do it within 24 hours of when your symptoms start.
Oh, really?
Might help reduce how bad your cold is and how long it lasts.
Interesting. So it's not necessarily preventing it, but it might help you get over it faster.
Yeah, exactly. But it's really important to remember that not all zinc supplements are the same. Lozenges and syrups, those seem to work better than pills.
Okay, good to know.
And just a word of caution, avoid those zinc nasal sprays. They can actually cause a loss of smell, and sometimes it's even permanent.
Oh, wow. That's definitely a side effect I want to avoid.
Right.
So what about other popular supplements, like vitamin C, echinacea? Those are ones that people often talk about.
Yeah. So vitamin C, it's a powerful antioxidant, and it does play a role in immune function, but studies haven't really shown that taking extra vitamin C actually prevents colds. It might shorten the duration, maybe lessen the symptoms a little bit, but it's not a cure-all.
Okay.
And echinacea, it's another popular one, but the evidence there is kind of inconsistent. Some studies suggest that it might offer a little benefit, others show no effect at all.
So the jury's still out on those.
Pretty much, yeah.
Is there anything we can do to really proactively support that immune system?
Absolutely. Remember those lifestyle factors we talked about before? Getting enough sleep, managing stress, eating a good diet, exercising regularly.
Right.
Those are really the foundation of a healthy immune system.
Yeah, like building that solid base for your body's defenses. So what about when you're already starting to feel a cold coming on? Is there anything you can do to either stop it completely or at least make yourself feel less miserable?
Honestly, the best medicine when you're fighting a cold is rest.
Yep.
Give your body the time it needs to heal, avoid any really tough activities, and if you can, take a day or two off from work or school.
I know it's so hard to slow down sometimes,
I know.
but I've definitely learned that pushing through it usually just makes it worse.
You're not wrong. You'll recover much faster if you just rest. And you won't spread the virus to other people, so it's kind of a win-win.
Very true. What about staying hydrated? How does that
help? Hydration is so important when you're sick. It helps thin out the mucus, so it's easier to cough up or blow your nose. It also helps prevent dehydration, which can make you feel even worse. Water is always the best choice. But you can also have warm broth, some herbal teas, maybe diluted juice. Just try to stay away from sugary drinks because those can actually suppress your immune system.
So ditch the soda and go for something soothing and hydrating. Now let's talk about those pesky cold symptoms.
Okay.
We've talked about those over-the-counter medications. Are there any natural remedies that can also provide some relief?
There are a few things you can try at home. So gargling with salt water that can soothe a sore throat.
Yeah, I've heard that.
Inhaling steam from a hot shower or a bath can help loosen up congestion. Saline nasal sprays or rinses, those are good for clearing out your nasal passages.
Oh, I love using a saline rinse when I'm congested. It feels like a little spa treatment for your sinuses.
I know, right? And for a cough, honey can be surprisingly effective. It just coats the throat and has a soothing effect. But remember, honey is not safe for babies under 1 year old.
Good point. What about essential oils? I've heard those can be helpful for congestion too.
Yeah, some people find that diffusing essential oils like eucalyptus or peppermint really helps. It can make the environment a little bit more soothing and it helps open up those airways. You can also add a few drops of eucalyptus oil to a bowl of hot water. Oh, yeah.
And inhale the steam.
It's like a little aromatherapy sauna.
Exactly.
So many good natural remedies to try. Now, I want to switch gears a little bit and talk about something called a chest cold,
Okay.
which can be pretty bad. How is that different from a regular cold?
So a chest cold, the medical term is acute bronchitis.
Okay.
It's basically when a cold spreads down into your lungs, into your bronchial tubes. So that causes inflammation and mucus buildup, which leads to that persistent cough that brings up phlegm. You might also experience shortness of breath, some chest tightness, especially when you're coughing.
So if you feel like that cold has traveled deeper into your chest and the cough is productive, meaning it's bringing up mucus,
Right.
that's a
Making
sign it
cold
might
milk.
be something more.
Exactly. And while most chest colds will clear up on their own with rest and some home care, it's always a good idea to check with your doctor,
Okay.
especially if you have any other health conditions.
Good advice. So I have a question that might seem a little counterintuitive.
Is it okay to exercise when you have a cold?
With this, you really have to listen to your body. If you just have a mild cold with a runny nose and a little bit of a cough, some light exercise might actually be okay. It can help boost your circulation and even temporarily relieve some congestion.
So like a gentle walk or some stretching, that could be all right.
Exactly. But if you have a fever, if you're achy, or if you're really tired, it's crucial to rest and let your body fight that virus. If you push yourself too hard, you could actually make it worse.
Okay.
And remember, when you exercise, it temporarily suppresses your immune system a little bit.
Really? I didn't know that.
So you might actually be more susceptible to other infections. So if you do choose to exercise, make sure you stay hydrated, listen to your body, and don't overdo it.
Great advice. It's like that saying, listen to your body, it whispers before it screams.
That's a good one.
Now, let's get back to a simple but really important weapon in our cold-fighting arsenal. Hand hygiene.
Can't stress that enough.
Right.
Hand hygiene is really one of the most effective ways to prevent the spread of cold viruses. Think about it. We touch so many things every day.
Oh, yeah.
Doorknobs, elevator buttons, shopping carts, our phones.
Right.
It's a germ highway out there.
It is. It really is.
All of those surfaces, they can have tons of viruses on them.
Yeah.
And they're just waiting to get on your hands, make their way into your body.
It's like we're playing germ roulette.
Pretty much, yeah.
So hand washing, that's key. But how do we actually do it right?
The key is to wash your hands often. And I mean really wash them thoroughly with soap and warm water. Lather up for at least 20 seconds.
Okay.
Get under your nails, between your fingers, backs your hands. It's not just about rinsing them off.
Right.
It's about the friction and creating enough lather to really get those viruses off.
Like giving those germs a mini surgery.
There you go.
So what about when soap and water aren't an option? Does hand sanitizer actually work?
Hand sanitizer is a good backup plan, especially when you're on the go. Just make sure it's got at least 60% alcohol in it.
Got it.
Put on a good amount, rub it all over your hands, between your fingers, around your nails.
Okay. So hand hygiene, that's our first line of defense.
Right.
But what about our internal defenses? How can we really make that immune system stronger so it can fight off colds?
Well, it's all about supporting those natural defenses that you already have. And a healthy lifestyle is a big part of that. We've talked about sleep, managing stress, and eating a healthy diet, but let's go into those a little bit more.
Yeah, let's dive deeper. So let's start with sleep. Why is sleep so important for our immune system?
Think of sleep like a nightly reset button for your immune system.
Okay.
So when you're sleeping, your body actually releases proteins. They're called cytokines, and they help regulate your immune response. They help fight off infection. But when you're sleep deprived, your body doesn't make as many of those cytokines. So you're more vulnerable to getting sick.
So those late night study sessions might be backfiring a little bit.
Exactly. You need to aim for at least 7 to 8 hours of quality sleep every night. And this is especially true during cold and flu season.
7 to 8 hours. I'll try my best. Now let's talk about stress. I know for me, when I'm stressed, I feel like I get sick a lot easier. Is there a connection there?
There definitely is. Chronic stress weakens your immune system and makes you more susceptible to infections. When you're stressed, your body releases hormones, things like cortisol, and cortisol can actually suppress your immune response.
Oh, wow. So stress is basically giving those cold viruses a free pass into my body.
You could say that.
That's why it's so important to find those healthy ways to manage stress.
It is. It's not just good for your mental well-being. It's really important for your physical health, too.
Yeah, absolutely. So what are some good stress-busting techniques that can actually help boost immunity?
Exercise, that's a great one. It releases endorphins, which help you feel good.
Yeah.
And it can also help you sleep better. Yoga, meditation, spending time in nature, even listening to some calming music, those are all good ways to relax.
It's all about finding those things that bring you joy, help you disconnect a little bit.
Exactly. And don't forget about social connection. Talk to your friends, your family, share how you're feeling, get some support. Those are all important ways to cope with stress.
It's like having your own built-in support system.
Right.
So we've talked about sleep, stress. What about nutrition?
Right.
How does that fit into all of this?
Well, nutrition, that's like the fuel for your immune system.
Okay.
So eating a healthy, balanced diet gives your body everything it needs to function at its best, and that includes fighting off those infections.
So lots of fruit and veggies, whole grains, things like that.
Yes, absolutely. Those foods, they're packed with vitamins, minerals, and antioxidants that really support immune function.
That's like giving your immune system a super smoothie.
I like that.
What are some of the specific nutrients we should be focusing on?
Okay, so vitamin C, it's a powerful antioxidant that helps protect your cells from damage.
Okay.
It's really important for your immune system to function. You can get vitamin C from citrus fruits, berries, leafy greens, things like that.
Got it. So eat my oranges and spinach.
Exactly. What about vitamin D? That's another one that's really important for immune regulation. And some studies have shown that it might actually help reduce your risk of respiratory infections.
Interesting. Where do we get vitamin D?
You can get vitamin D from fatty fish, egg yolks, and fortified foods.
Okay.
And of course, don't forget zinc, which we talked about before.
Right, the lozenges.
It's essential for developing and maintaining those immune cells.
Mm-hmm.
So oysters are the best source of zinc.
Okay.
But you can also get it from beef, nuts, and seeds.
So it sounds like eating a diverse and colorful diet is really key.
Absolutely. And don't forget to stay hydrated.
Right, of course. Water.
We talked about how important fluids are. Thinning out that mucus, preventing dehydration, and supporting your body's natural healing process.
Water is my new best friend.
Good. It's essential. So we've talked a lot about how to prevent colds.
Mm-hmm.
But let's be realistic. Colds happen.
Yeah, they do.
So let's go over some more strategies for managing those symptoms when they do pop up.
Okay, sounds good. So we've talked about rest, hydration, over-the-counter meds, those natural remedies. What else can we do to make ourselves feel better?
Let's talk about humidity.
Okay.
Dry air can irritate your nasal passages and make it harder to breathe, especially when you have a cold. So if you keep a comfortable level of humidity in your home, it can help soothe those symptoms.
That's probably why we feel worse in the winter when the air is so dry.
Exactly. And the most effective way to increase the humidity in your home is to use a humidifier. You can get different types. But cool mist humidifiers, those are usually safer, especially for kids.
Right.
And they're less likely to cause mold.
Safety first. Are there any other ways to increase humidity if you don't have a humidifier?
Yeah, you can put bowls of water around your house,
Okay.
especially near those heat sources. Taking a hot shower or bath can also help temporarily increase humidity. And believe it or not, houseplants, they're natural humidifiers.
So they're good for more than just looking pretty.
They are.
Okay, so we've gone over a lot of ways to manage those symptoms at home. But when should you actually go to the doctor for a cold?
That's an important question. While most colds are mild and they go away on their own, there are a few things you should look out for. If you have a high fever, so over 101.5 degrees Fahrenheit for adults, or over 100.4 degrees for babies under 3 months.
Got it.
If you have a really bad headache, a stiff neck, trouble breathing, any shortness of breath, chest pain, wheezing,
Okay.
confusion, if you're vomiting a lot or having diarrhea, if your symptoms just aren't getting better after 10 days, or if they're getting worse, you should definitely call your doctor.
Right. Those are all signs that it could be something more serious.
Exactly. It's always better to be safe than sorry.
True, true. So let's kind of wrap things up here with some final thoughts on how to stay healthy.
Okay.
Stay resilient during cold and flu season.
It really comes down to building those healthy habits and supporting your immune system, getting enough sleep, eating a healthy diet, staying hydrated, managing that stress, good hygiene. Those are all important things.
It's not about quick fixes.
No.
It's about creating a lifestyle that supports your overall health and well-being.
Exactly. And remember, knowledge is power. Stay informed. Check out the latest recommendations from health experts. Don't be afraid to ask your doctor questions.
Good advice. Now, before we move on to listener feedback,
Okay.
I want to hear your thoughts on something you mentioned earlier.
Yeah.
We talked about how cold viruses are constantly evolving, right?
Right.
So what do you think the future holds for cold prevention and treatment?
It's really exciting to think about what the future might hold. As we learn more about these viruses, we might be able to come up with better antiviral medications. Maybe even a universal cold vaccine one day. Imagine no more colds.
That'd be amazing.
Right.
But for now, let's focus on what we can do today to stay healthy and avoid those colds as best as we can.
Absolutely.
We'll be right back with some cold-busting tips from our listeners. Welcome back to Medic Talk. So we've been talking all about the common cold, the science behind it, all those tips for prevention and treatment. But sometimes you just need those, good old-fashioned home remedies or tips from friends. What do you think?
Oh, absolutely. Sometimes those simple solutions are the most effective.
Exactly. So we actually reached out to our Medic Talk community. On social media, we asked them for their best cold-busting tips.
Oh, nice.
And let me tell you, they did not disappoint.
I love hearing what people find helpful.
Me too. It's great.
It's like a treasure trove of home remedies.
Exactly. So are you ready for some cold-busting wisdom?
Hit me with it.
Okay, this is a classic. One listener said they swear by a warm honey and lemon drink for a sore throat. They said soothes that scratchiness, makes them feel better instantly.
That's a good one. Honey has those natural antibacterial and anti-inflammatory properties. And then lemon, you've got the vitamin C in there, which can help boost your immune system.
It's like a warm hug for your throat.
I love that.
Now, another listener, they said for those really stubborn, stuffy noses, saline nasal rinse all the way.
Oh, saline rinses, those are great.
Right.
They work so well for clearing congestion. They flush out the mucus, any allergens, really help you breathe easier.
It's like giving your nasal passages a refreshing shower.
I like that.
Okay, here's one for those who are into those natural remedies.
I'm okay.
One listener suggested diffusing essential oils like eucalyptus or peppermint
I love that.
to help open up the airways and just make the room smell better, more soothing.
Yeah. Eucalyptus and peppermint oils, they have such a refreshing aroma.
Yeah.
And they can help you feel less congested.
Right. You could even add a few drops to a bowl of hot water, do like a steam inhalation.
Oh, yeah, your own little aromatherapy session.
Exactly. Okay, this last tip is a simple one, but it's an important reminder, and it came from one of our listeners.
Yeah.
And they said, listen to your body and rest when you need to. They were really emphasizing that, pushing through a cold often makes it worse.
Couldn't agree more. Rest is so important to let your body heal and recharge. Sometimes the best thing you can do is just slow down, stay home, let your body do its thing.
It's like hitting the reset button on your health.
I love that.
So there you have it. Some awesome, tried and true, cold-busting tips from our wonderful Medic Talk community.
Love it. I love that we can all learn from each other, share these helpful tips. It really shows that we're all in this together.
It does. It really does.
Right.
So before we wrap up this deep dive into the common cold,
Okay.
I'm going to go back to a question that you posed earlier.
Okay.
We talked about how cold viruses are always evolving, right? So looking ahead, what do you think all of this means for the future of cold prevention and treatment?
It's really fascinating to think about. As we continue to learn more about these viruses, we might be able to develop even better ways to prevent and treat them. Maybe even more targeted antiviral medications. Who knows? Maybe one day there will be a universal cold vaccine. Imagine a world without colds.
That would be amazing.
It would.
But for now, we just have to focus on what we know works. Those healthy habits, preventative measures, those tried and true home remedies that can help us stay as healthy as possible.
It's really all about giving yourself the tools and the knowledge to take care of your health.
Well said. All right, well, that's all the time we have for today. Thank you all for joining us for this deep dive into the common cold here on Medic Talk.
It's been great. Thanks for having me.
Of course, thank you for being here.
Of course.
And to all of you listening, stay healthy, keep those hands washed, and remember, knowledge is power.
See you next time.
Bye, everybody.
Bye.